Hi, my name is Chien Hung, and I am the program director of the Ombudsman program at Voice in St. Louis, Missouri. So ombudsman is an interesting word that simply means to advocate for older adults, for residents that live in long-term care facilities in Missouri. Now, it is a federally mandated program for all 50 states. Every state has its own ombudsman program. However, every state defines their long-term care a little different. So that's why every state, the ombudsman, how they can intervene, what they can intervene with, it's also a little bit different. It depends on where you are, and then they decide then what your ombudsman can do. In Missouri, in particular, long-term care ombudsman program is to help advocate for residents, and the residents live in long-term care, and they are skilled nursing facilities, intermediate care facilities, assisted living facilities, and residential care facilities. These four levels, they are the four levels that are defined as long-term care in the state of Missouri. Okay, now we're going to talk about Medicare and Medicaid today. So I have a set of slides here. This project is supported by HRSA and my organization, Voice, the Ombudsman Program, and SLU, St. Louis University. We work together to complete this project. I don't have any financial conflict that I need to disclose at this time. And then here's the goal of my presentation. Now, I'm gonna run through all of these slides very, very fast here. And then, of course, you don't have time to read all any of them for now, because these slides, the information, is for you to review without me going through them with you. Okay, so now they are very helpful. And then here's my contact information, that my email is on the bottom here. So you can actually get the slides after you've listened to or watched my presentation here. But then I'm not gonna present through with the by running these slides. I'm gonna present with a different kind of approach. Okay, so after my presentation, you can actually find the link for the slides. The link you can click to connect to the slides, and then you will find this information. Now, I'm gonna stop sharing, and then you're gonna watch me talking about Medicare and Medicaid here. Okay. Now, so Medicare and Medicaid, they are two different governmental health insurance or medical insurance. Okay. Medicare, C-A-R-E, it is a federal medical insurance versus Medicaid, it is a state insurance, medical insurance. Okay. And then Medicaid, Missouri Medicaid, we actually have our own branding. And for Missouri Medicaid, our branding is called Mo Health Net. So two words. Mo stands for Missouri, MO, right? And then Health Net, that's one word. So Mo Health Net, that is Missouri's Medicaid. Okay. Now, federal's Medicare, your social security number is on your Medicare card, and that is your Medicare ID. Versus Medicaid, you have an 8-digit DCN number. Okay, it is DCN stands for Document Control Number, DCN number. Okay, so there are two different numbers. Medicare, it is your Social Security number. Medicaid, it is your 8-digit DCN number. Okay. Now, the federal Medicare is an age-based program. That means as long as you are 65, you qualify to have Medicare. Okay. And then if you are not 65, but you have certain particular diagnoses, some certain disease diagnoses, you might qualify to have Medicare as well. Okay. But for the most part, it is when you hit that 65, you qualify to have Medicare. Okay. The state Medicaid program, it is an asset value based program. Okay, I'm going to repeat, asset value based. Once you have limited assets, therefore, that means you don't have a lot that you own. Then you qualify to have Medicaid. Okay, and what is how limited is limit? So it is the total value should be $5,909.25. Okay, I'm gonna repeat. It is 5909.25. $5,909.25. That is the cutoff line. That is the limit. Okay, so the total value of your total assets, if it's less than that number, 5909.25, then you qualify to have state Medicaid. And I'm specifying this is the Missouri Medicaid. Okay. Now that $5,909.25, there is some exceptions. So for example, you get to have a house, and the house does not have to be counted towards this limit. Okay. You get to have a car, and the car does not count towards this limit. Okay. But other than a house and a car, you cannot have a second house, your summer cabin. You cannot have a second car, or you have a boat, you have a horse. They don't count. They outside of a house and a car, if you have other things, they have to be counted towards this limit. Okay. Now, if you have jewelry, if you have very expensive furniture that you put in your storage unit, it is not being used in the house, then those are counted towards your limit. Okay. You can have life insurance. You can have prepaid burial plan, sure, but you need to make sure your life insurance and your prepaid burial plan, they cannot be revocable. Okay, what is revocable? Well, I've been paying for 10 years for my prepaid burial plan, and now tomorrow I just decide that I'm no longer doing this prepaid burial plan. I've paid so much. I'm tired of it. I don't want to do it. Then tomorrow I can terminate. I can end the contract with that whatever company that I have a burial plan with, and then I can end that contract. I might need to pay some penalty, sure, but tomorrow morning I get to cash out. I get to have cash value of this burial plan. Maybe the entire burial plan is $10,000, and tomorrow morning they are gonna take 2,000. That's the penalty, and then I get to have $8,000 as my that I can spend on whatever whenever I want. That's considered revocable. I can cash it out anytime. If your life insurance, if your prepaid burial plan, they are revocable, that's considered your assets. They need to be counted towards your limit, your asset limit. Okay. So in other words, if you have life insurance, if you have a prepaid burial plan, you need to make sure it usually is specified in your contract with them. You need to make sure they are irrevocable. They are not revocable, and therefore they do not need to be counted towards the asset value. Okay, now keep in mind, as we are recording this video today, it is June the 20th, 2025. So this limit, this $5,909.25, usually it is adjusted every year. Okay, so this $5,909.25, it was adjusted from a different number just in July last year. So maybe this next month, that would be July 2025, it's gonna be adjusted again. Okay, so we don't know the number because we cannot predict the future just yet. Okay, so maybe at the time that you are watching this video, that number is adjusted. So please make sure to check that out. Okay, and then you can go to the Missouri Department of Health and Senior Services website, and then you can actually find that out. Okay, so let's keep moving. So for Medicare, CARE, the federal Medicare, it pays for short-term rehab. Okay, short-term rehab. It does not pay for someone to live in a facility for long-term. Medicare is short-term rehab. Short-term, how short? Up to 100 days. That's how short. Okay, and it is for, say, PT, OT, physical therapy, occupational therapy, these treatments. So Medicare will cover for those, or cover those. Okay, and then let's also not forget, Medicare will cover fully for hospice care, hospice services. If someone has less than 6 months to live based on their terminal diagnoses, then their doctors can actually prescribe hospice care, and then Medicare is going to pick up all the cost for hospice care. Okay, so that's Medicare here. Medicaid, CAID, Medicaid, the state program, that's the one that pays for long-term care for someone to live in a nursing home for long-term. Okay, but keep in mind, Medicaid only pays for semi-private room. What is semi-private? That means that you will have a roommate. That is semi-private. Okay, so Medicaid pays for long-term living in a facility, in a skilled nursing facility, but you don't have a private room. Medicaid, they do not pay for private, they pay for semi-private, so you will have a roommate. Okay, now that's the gist of Medicare and Medicaid, and you will be able to find all the information I just went through in the slides that we provide with this video. And then again, any questions, feel free to reach out to me. My email is on the very bottom of the last slide. Okay, so any questions, let me know. Thank you.